So, coming on to the next question, which is also more relevant to the theme this year, that is the legalities and the advances so far. So, the next section involves, we have many, I think every patient who joins the support group asks this question as to what are the facilities or services available for a person who is not monetarily well off, and what is the process of insurance that they can apply for, what is covered under the insurance currently, especially in Karnataka, since we are catering to today a Karnataka specific group. Could you shed some light on it, doctor?
So no person with any disease should be denied of the medical facility. And Government of India and Government of Karnataka have what is called as a right to health, like a right to education, right to health act. So it comes under something called Arogya Karnataka. They have some 2018 or somewhere they have got this.
Ayushman Bharat, doctor?
Not Ayushman Bharat, Arogya Karnataka plan. 2021, it is gazetted. So every person with disease, any disease, have a right for accessing healthcare. And government does provide, supposed to give free access to many people with the disease. This is done generally in government hospitals. Problem is government hospitals don't have enough trained rheumatologists to provide the services. So on paper, if you go to a medical college and a government hospital, you should be getting treatment free of cost. But that doesn't always translate into care. And organizations like ESI provide good healthcare for whoever is enrolled with ESI. And it is tough for patients who particularly require more expensive therapy. We don't have an easy access to healthcare facilities where trained clinicians are available. So, but on paper, as per law, everybody has equal right for access to health, irrespective of whatever disease you have. Some of the minor diseases like thalassemia and immunodeficiency syndromes are covered by government. Government pays for their IV immunoglobulin, etc. But it is not still true for your lupus and other autoimmune diseases. But wherever the government facilities are available, they should be able to get the treatment, appropriate treatment. Regarding insurance, again, according to law, nobody should be denied of insurance. And if you go to any of the websites of the insurance companies, they say that people can, with the lupus or arthritis, can get insurance, but they may have a higher premium and there's a waiting period. So if you start insurance today, first 5 years, your lupus will not be covered. And you need to pay higher premium. So I have spoken to quite a few people with who had the insurance companies. They all see these autoimmune diseases as potentially which can give them a lot of expenses. So they generally tend to avoid giving them. So though legally you cannot be denied, but most of the insurance agents, moment they see some of the diagnoses, like rheumatological diagnosis, like lupus, arthritis, rheumatoid arthritis, it is denied. If somebody goes to consumer court and fight it out, you cannot be denied the insurance. But I had a pleasant talk with one of the CEOs of a company. He said, "Doctor, you have to wait for some time. We cannot refuse insurance to anybody. In the near future, we all will come out of insurance schemes which would help everybody with autoimmune diseases. We may charge them little more. We may give them some like a period, first through to 5 years waiting period before they can avail all these things, but it will come. I think hopefully in the near future, you all should be able to avail insurance. But at this moment, it is difficult. And I see patient, at least one patient a day says that I'm not able to get insurance every day. So the theory and what is practiced is still not matching. the government has a good intentions, but insurance company, it's a business for them. They are not seeing it as a viable option to give insurance to people with chronic diseases.
Definitely, doctor. This is one thing that needs more. I mean, it is good to hear that there is some hope in the near future. Many of us are looking forward to it. And keeping this in mind, also, what are the current policies that are functioning from Karnataka government or from the Indian government, which can be applied for patients of lupus? Could you shed some light on this?
I'm not sure which is anything which can specifically apply to lupus. I think everybody has access to that Ayushman Bharat and some of the Vajpayee schemes. If you are below poverty card holder, you are eligible for many treatment. If you are employed in any organization where you are eligible to get a ESI, there the health coverage is very good. Health coverage is very good. If you have a central government employee, CGHS schemes cover most of the drugs. Problem is most of the hospitals still don't have a fully trained rheumatologist, but that problem will get solved over time because from my days, only 4 rheumatologists were coming per year. Per year in India, like only 4 trained rheumatologists, 2 from Madras and 2 from Lucknow. Now there are 70 to 80 rheumatologists are coming out every year. So they are likely to find employments in multiple areas. Victoria Hospital, our Indian Rheumatology Association Karnataka chapter, we are running a weekly OPD in Victoria now. So many of us go once a week on Thursdays. We are trying, but I think it's still what should I say? Unmet needs.
I think even a drop is enough to create an ocean, doctor. So this is a start, a good hope for all patients, and looking forward to the changes in the near future. Coming to the last question of today's session, to end off on a hopeful note, what are the recent advances in medicine that we are seeing with respect to lupus? Because there are a few things that keep popping up as to CAR T cell, it's going to cure your lupus completely. So, coming from you, the expert himself, would be exciting and hopeful for the patients as to what are the recent advances, what are the things that we can look forward to as lupus patients.
Really exciting time in the field of lupus because of the better understanding of the immune system and autoimmune basis of the disease. Earlier treatments were like a general treatment. You know that immune system is overactive. We put a lot of sand and water to douse the fire. Now we know where the immune system is going wrong, and we are understanding more and more about the nuances, complicated interplay of immune system. So that is leading the way to newer and newer therapy. As you had alluded to, CAR T cell therapy is a big promise and a potential cure. But at this moment, it is out of reach because it would cost anywhere between 50 to 60 lakhs per patient, and it carries some amount of morbidity as well because there are a brief period. It is like you are totally immunosuppressed, vulnerable for infections. So it is not a simple like take 10 tablets for a week and then you are cured forever. No, it is not that way. It is a very complicated procedure, but this is a first step. I think people are building on this, and hopefully in the near future, the cost will come down. If it is going to be available for 10 lakhs, a cure, it is worth then having the disease for a lifetime. So exciting time. There are new antibodies and directed therapies are also coming up. There are already quite a few are available abroad, is still not yet available. They are not cure, but they can take care of the disease when the conventional treatment like steroids or azathioprine, mycophenolate, and other drugs which we use are not helping the patients. There can be few other biologicals which are available like a Benlysta, Anfrilimab. They are all available, and sure they will come to our country. CAR T cell therapy can be done here because it is It is done by people who are hematologists, and it is done commonly for leukemias. So technology is there. So they have already started doing it for cancers. And cancer people would somehow do it because it is a life-threatening disease. When it comes to an autoimmune disease, still people are little not sure whether they should send everybody there at this moment, because many of them will do very well with the minimum drugs. So why do we expose them to a very potent therapy? But somebody who is sick and who is not doing well, and but we have some hope. And definitely another 5, 10 years, things will change. People will become more experienced in this technology and it can become cheaper.
Thank you very much, Doctor. That was very hopeful to hear. And it's interesting to see the advancements in science and how it is always progressing towards a better future. So that brings us to the end of this session, as well as the webinar in terms of interaction, the questions that we could collect from the patients. Coming in terms of legalities and advances, to summarize, as you told, that there are few insurance companies which do cover, but few are also promising better responses in the near future. And a few under ESI and under government setups, there is right to health for everyone. And hopefully, we will see a better condition in the near future for patients who are on with monetary constrictions. Um, to conclude, Doctor, what would you say the take-home messages would be for patients of SLE and the support system?
Yeah, and in this forum, I would hesitate to call everybody who has lupus as patients. You are not lupus. You are not lupus patients. You are lovely people who happen to have a small disease called lupus. And my suggestion is, okay, lupus is a chronic disease, and you may have to many a times take medicines on a long-term basis, but there can be happiness, and happiness can coexist with lupus. And be hopeful.
Thank you very much, Doctor, for the warm take-home message. Be hopeful, be happy.